What's the most impressive case of Google a self-diagnosis that turned out to be true? Weirdest I've heard of was Philip K. Dick believing in a dream he had that his perfectly healthy presenting baby son had a fatal inguinal hernia. Despite doctors' resistance, detailed exam of son found and successfully treated it. Apparently made PK Dick really question reality. Certainly inspired fantastic stories he wrote and are still being made into movies. My uncle was 100% convinced his baby daughter had pneumonia. She wasn't coughing and had a wheeze that was so faint the doctor didn't hear it and actually called in his nurse to listen. And thank heaven he did. I've met doctors that would have just gone with their own judgment, especially when little cousin wasn't showing any symptoms other than her lips being dark. She said she heard something but wasn't sure. X-ray showed she had a lot of pneumonia on both sides. Her blood oxygen was scary low, but no one checked that until after the X-ray for reasons. She's a healthy teenager now. On a far less serious note, I can tell as soon as my kids come down with strep. No fever, no sore throat, but there is an odor. A couple days later the fever hits. We are able to treat quickly though. I know a pediatrician who can smell strep. He walks into an exam room and knows the issue. It's a useful skill. Burn nurses can tell what a patient's infection is by smell. Elder care nurses and even CNAs can diagnose C. diff by smell. It's very memorable. Likely most nurses can. For me, COVID has a certain taste. I'll sneeze and that taste just appears. On the flip side was Sylvia Plath's father. His friend had died a terrible death from lung cancer after several surgeries. And when Otto Plath started feeling poorly, he decided he had cancer. He didn't go to the doctor because he didn't want to be treated. He got sicker, and then he died from diabetes. Welp. I didn't know I had. Medically paranoid father refuses to go to the doctor and then actually dies of it, in common with Sylvia Plath, but this makes me understand her a little bit more now. When I was in high school, one of the science classes had to do a project on systemic diseases. This kid chose diabetes. They noticed the symptoms matched what they had been feeling lately, went to the hospital, and it turned out they were days to hours from a diabetic coma. I think it's a miracle it went undetected for so long. But then again, I don't know much about diabetes. They are now a medical professional. So this story really came full circle. In my diagnostic medicine class in high school, we learned about congestive heart failure and all of the symptoms and everything. I was like, this sounds like my dad. I went home and told him about it and that he should go to the doctor. Unfortunately, he did not go see a doctor and died a few weeks later due to, you guessed it, congestive heart failure. Oh, wow. That's awful. Yeah. It was a pretty shit time. Never been so upset to be right. This is really strange to hear because it's so similar to what happened to my family. My grandmother was unwell for ages, but the doctors kept saying it was old age, etc. My friend, a first-year medical student at the time, heard me talking about it and said, that sounds like heart failure. She went to A&E/. Turns out, it was heart failure. Strangely, this also happened to a former BF of one of my friends. He was working on a diabetes project at school and discovered that he had every symptom of type 1, and it was really serious. He'd never even thought of diabetes before starting the project. The illness just randomly appeared while he was working on it. Type 1 is really sneaky like that. Type 1 used to be called childhood diabetes, and I've always wondered if that's just because if they didn't diagnose and treat it, the kids didn't make it to adulthood. I have a Gen X relative who was diagnosed in college, and apparently that was very unusual at the time. My anesthesiologist was blown away the other month that I got type 1 in my 20s. It's an autoimmune. Your body likes to turn your whole life upside down at any given age. I was diagnosed when I was 6, and my older sister used to give me a bunch of shit for it. She was diagnosed at 34, and if I was a better person I'd feel terrible for this, but fuck you, Emery, how does it feel, bitch? Satisfied Wilford Brimley noises. My son was diagnosed type 1 at 28. The lack of knowledge that the general populace has about diabetes is astounding. After his diagnosis, so many folks were like, he just needs to watch his diet and take a shot, right? Or the infuriating, he can't have diabetes. He's not overweight, he's a brittle diabetic. It's taken 4 years to get it under control. He can do everything 100% right and still have an extreme high or low. And it's autoimmune, as you said. His body fighting itself relentlessly. It's exhausting, and I'm just his mom. My daughter, 17, was diagnosed with lupus a couple years ago. Autoimmune disease is the fucking devil. When N.M. Martin wrote a character with diabetes into the Babysitter's Club books, many people of different ages, who read the books, realized they had the symptoms and went to the doctor, and ended up being diagnosed. It wasn't talked about much in those days. So I think there needs to be more characters with common health conditions in mainstream media. Then people might actually be diagnosed when they recognize those symptoms in themselves. Who knows how many lives and M. Martin saved when she created Stacey McGill. That happened to a friend of mine. Her dad was actually a doctor, so he decided to make a little fun project to prove she didn't have diabetes. He brought home these dipsticks that activate in the presence of sugar. Then they got apple juice, Pepsi, and her urine. He dipped a strip in apple juice. It reacted. He dipped a strip in Pepsi. It reacted. Then he said, "But see, your urine doesn't react," as he dipped the strip in her urine. But it did. She was super excited that she beat him until she learned what a pita diabetes is. Reagent strips. They're available OTC at any pharmacy if people want to test for themselves. Under $20, don't confuse them with ketone diabetic strips. I'm type 1, and as a kid my mom would keep them in her purse to test the Diet Coke to make sure the waitress didn't bring a regular Coke mistakenly, which would shoot my sugar up. My aunt was for some reason one day watching Arthur as an adult. It was an episode wherein Buster was diagnosed with asthma. She listened to the description they gave in the episode and thought it sounded familiar. Turns out she'd had minor asthma all her life and had no idea until she was watching a cartoon on PBS. This is exactly how I learned about diabetes. No one in my family has it, but I read every one of those books and was super into how Stacey was doing. Only funny in hindsight, but in full-blown DKA, I was Googling DKA symptoms, diabetes, because everything I Googled kept coming back with type 1 diabetes. Next day my doctor sent me to the with a note, and I got admitted within 10 to 15 minutes. I knew right then that it was serious. Also not a medical professional, but I diagnosed myself and my doctor was pretty flummoxed. For years I had horrible periods, and had that holes could be endo, could be fibroids runaround, but I also couldn't use tampons. I would somehow just bleed past them, which made less than no sense, and my period cycle was so off sometimes I swore it was like I had 2 uteruses. Then one day I was listening to a podcast and a woman started talking about her experience of living with 2 uteruses. And I was like, damn, that's me, told the GP. She reluctantly sent me for the scans, told me it almost certainly wasn't that given the rarity. But yep, turns out I have 2 uteruses, cervixes and vaginas. And 1 unit of a kidney instead of the factory issue too. Also my mom thought I was mad and jokingly bet me a car I didn't have 2 uteruses. Still chasing her up on that. Edit, don't know how to feel about my most popular comment being about my coochies. Mom needs to pay up. Reddit has spoken. 2 cars. 1 for each coochie. If God gave you a 2-car garage, you should have 2 cars. This was my mom. Back when my mom was pregnant with me, mind you. She was 5 foot tall and 100 pounds soaking wet. My dad, Navy, left to go out to do maneuvers I think it's called. It's when the ship is not docked but not deployed so it can be fairly close to base, anyway. They figured all was well because I wasn't due for 3 more months. Wrong. My dad left and the next day my mom went into labor with me being born 12 weeks and 2 days early. This was in 1969 and I weighed 2 pounds 11 ounces. My dad was sent a Western Union telegram saying my mom was stable and doing well and I was listed as, I saw the telegram but can't remember what the words were, let's just say they weren't optimistic I would make it. He gets back to shore and when he walks in to see my mom she's just sitting in the bed looking shell-shocked. She starts crying, they said I'm pregnant again. Turns out she had double uteruses, 3 fallopian tubes and 4 ovaries, but 1 cervix. So she was pregnant with me on one side, but the other side was ovulating and she got pregnant with my younger brother on the other side. And she had my older brother who was almost 2 at the time. So me and my younger brother are 8 months apart. The doctors had to figure out how she was pregnant after giving birth so they dug deeper and there you have it. My older brother's pregnancy was normal, no complications, so up until me she was unaware of her condition. Whoa, amazing to have a brother 8 mo's apart. And, OMG, your poor mom not getting a break between babies/pregnancies. At one point she had 3 babies in diapers. I still am amazed and when I asked her how she did it all she would say is, I managed. I had to. She passed in 2018, oh how I miss her. She was a firecracker. Even crazier to think that. Since you were 3 months early, you were only developmentally 5 months older than your brother. Those 3 months gave me such a huge advantage, trust me. 2 uteruses? You're running life on hard mode for no reason. This is wild and I'm glad you got diagnosed. I love your username. Your mom for sure owes you that car. Hey, me too. Well, sort of. No duplicated vagina. Mine was diagnosed during an appendicitis workup. When I asked my mom, what the hell? She said she was tired after my 3 older sisters. The advice of doctors, when I asked what it meant, they said just not to donate the 1 kidney I have. Wait a sec. I'm extremely curious if there's a direct connection between having 2 uteri and 1 mega kidney. Or if you and OP both just lucked out. There is. Look up Müllerian anomalies. During embryonic development, renal organs and genital organs form at similar times from similar tissues. It's really common to see urinary anomalies alongside gynecologic ones. Here's a good overview paper of genitourinary embryological development and a relevant section on pathophysiology, particularly the description of relevant clinical conditions due to abnormal physiological development. Thought it was neat to share since it makes sense both organ systems come from neighboring stem cells in the embryo. Nurse practitioner, my first primary care job was seeing adults in an affluent part of a big US city with a lot of well-educated, well-connected people who were generally extremely healthy. Some certainly had the money to be described as eccentric instead of a more pejorative term like a crazy, so I was used to a lot of pre-visit Googling in the worried well. Coming from a background in emergency medicine, I did a lot of reassuring that no, they were not in fact actively dying. One regular who pushed the eccentricity scale to the limit came in for a sick visit, saying he'd been fatigued and having intermittent low-grade headaches. These are extremely nonspecific symptoms with an endless differential list, so I tried to get more information as I conducted an exam and reviewed his recent notes. Everything looked fine, and he'd had a physical with blood work not long ago, so I suggested he probably had a virus and we should do some watchful waiting with symptomatic care, rest, hydration, NSAID/Tylenol, etc. I always end with summarizing the symptoms reported and what the plan will be. He goes, "Oh, did I mention the dead birds?" No. Thinking this visit was about to take a turn as I was heading out the door.
Yeah.
There's been a lot of dead birds in my yard, so I think I have West Nile virus. Turns out he did. I had always heard about the more severe presentations of West Nile virus, such as encephalitis, but it can be very mild or asymptomatic. I jokingly refer to that case as the positive dead bird sign. Still just supportive care and watching out for any warning signs. ETA, wow. Didn't think this would blow up. To give more context on what led to actually testing him for WNV, because I don't just randomly go testing people for everything under the sun when they suggest it. Unnecessary testing leads to false positives, inconclusive or incidental findings that lead to more diagnostics that can have adverse effects like extra exposure to radiation through CTs or risks associated with biopsies. The patient had pictures of the dead birds on his phone, lots of them. So either this guy is a bird serial killer, has a deceased bird obsession, or there is actually something up, so I looked into it. WNV is spread through a transmission cycle of birds to mosquitoes then back to birds. It doesn't kill all infected birds, but it definitely can kill some US birds. I looked up local disease incidence rates published by the Health Department/CDC and saw there actually was a fairly sizable increase in local cases. When you said dead birds, I thought there was going to be something neuro/psych, but West Nile is even crazier. I have a large number of chickens and keep assuring my mom that they are a nice little indicator of any bird flu exposure among the humans. If the chickens all drop dead, we need to go to the hospital. Not impressive really, but I knew I had a blood clot in my leg, thank you Google, but also the signs were classic area felt warm. Calf was swollen, it was painful. I saw several GPs over the course of 2 weeks. I finally had a breakdown crying because I was terrified I was going to have a PE while alone with my nonverbal son because my husband was overseas and I fucking knew it was a blood clot. The tears finally made them refer me to a blood clot clinic that thankfully was happening the following day in the city nearby. After they found the clot, the nurse at the clinic told me my referral letter said I was being sent to put the patient's mind at ease. Clot was really big by then, of course. Fast forward, turns out I have a rare genetic blood clotting condition, hence the unprovoked clot. Least cool X-Men power ever. Edited to update, sorry, I'm in the UK. I posted this, went to bed, and woke up to probably my most popular comment ever, and of course it's about blood clots. Anyone who gets them is absolutely obsessed. I still remember when I had to be on warfarin and it was honestly all I wanted to talk about. My condition is called prothrombin gene mutation in the UK. It's a factor 2, and about 2% of the UK population is estimated to have it. For comparison, factor V Leiden is in 5% of the UK population. I had to look this up just now. It is not a flex though, now I'm going to own it as such. There's not much special about it. As far as I know, it's just a difference in the what proteins are causing the clotting. I am not on long-term blood thinners because I was given the option by the hematologist. He said that at my age at the time, etc. According to the data we sat down together to look at, I had about a 50-50 chance of it happening again, and being on the thinners for life carries its own risks. So here I am. I'm definitely going to go through the comments when I get home and respond a bit more. Thanks for the sympathy. And in my defense, I am not a weepy human being. In fact, I definitely give scary bitch face woman vibes most of the time, so I was very annoyed at being brought to tears over this. But I was genuinely terrified for my son, and to a lesser extent myself. If I'd passed out, he would have just been on his own for a week as a 2-year-old. It doesn't bear thinking about, really. Yes, I'm still angry at the multiple GPs involved, and it's almost 15 years later. I just argued and refused to leave the doctor's rooms. I'm not a crier. I am, however, a 60+ F. He, not my regular doctor, kept saying it's dehydration, take some electrolytes, and I kept saying no. I've been assuming it's dehydration for almost a week now, and home treating, and it's getting worse, not better. Eventually, he backed down and gave me an order for a blood test, probably just to get rid of me. Did the test, waited 2 days for results. My regular doctor phoned late in the afternoon to say, pack a bag and get to the hospital, you have complete kidney failure. Couple of hours in an ambulance, plus a further 4 days in the city hospital, and they finally found the diagnosis, a 1 in a million autoimmune condition. MPA vasculitis? Ouch. That's a nasty one. Mine was anti-GBM. Very similar symptoms and treatment, except I started with 14x plasmapheresis sessions to reduce the antibody load, as well as doing the steroid/cyclosporin. This one only attacks kidneys and lungs. Thankfully, it very rarely reoccurs, so I don't have to worry about relapses. This is my exact blood clot story. I googled the symptoms while I was leaving work and went straight to the hospital. The ultrasound tech said, I can't tell you what the results are, but I'm really glad you came here today. Got to spend 4 days in the ICU. I also possibly have the same rare genetic condition. Hooray us. Hughes syndrome? That would be a Hughes coincidence. Probably not the point of your story, but if I had $1 for the number of times people would only really listen because I started crying. It's amazing how many people don't listen to women. Diagnosed myself. Didn't have any dramatic symptoms other than poor appetite and fatigue. I knew I had something going on above my waist, but not in my chest. DRS blew me off, so I got a lung scan due to smoking history. Kidney cancer. Tumor was on the upper part and outside of the kidney. Small tumor, had a partial nephrectomy. Third post-surgery scan coming up. Keeping a good thought for you, and I hope your scan is clear. I'm not a doctor or a nurse, but I've got one. My younger brother dealt with persistent chronic ear infections and was supposedly diagnosed with eczema in his ears. They would often weep pus that smelled foul, and he would swab them every day. They were red and flaky inside, which prompted the eczema diagnosis, but I don't think explained the pus. So after 10 years of dealing with this, he gets fed up with it and decides to send off samples of his own for private testing so he could review every single bacteria that was present himself. Turns out the biggest colony was Candida. He was able to receive a now family famous prescription for his vaginal yeast infection, which cleared up his problem within 3 days. I currently have this going on 10 months. Why doctors don't listen. They kept giving me antibiotics when I kept saying it was fungal. I'm the first person they had to treat a fungal ear infection for apparently, and I'm in my 30s. 10 years. That sounds so agonizing. Fun fact, yeast infections can occur on multiple parts of the body, e.g. thrush. It's not specific to the vagina. I was in severe pain 2 days after working out. When I say severe, I mean any twitch of my thighs made me want to cry. I could barely move my arms, sitting down was horrendous. And I was on the verge of asking my now wife to help with using the bathroom. A half-empty ketchup bottle felt like I was trying to curl 20 pounds. Well, around an hour into my shift at a hospital lab, I went to the bathroom and noticed my urine looked like cherry cola. I talked to my former paramedic boss, told her what I was experiencing, and that I was concerned I had rhabdomyolysis. She agreed and told me to head to the I walked myself across the street to the and told the PA the story and told her I was worried about rhabdo. She kind of dismissed me, told me she thought it was unlikely, but she'll run some basic labs anyway to rule it out. 2 hours later she comes back with a nurse carrying 2 bags of saline and tells me that my CK levels are so high the lab is having to do serial dilutions to quantify the results, which is why it's taking so long. She didn't have an actual result back on my CK, but she knew it was high enough to need dilutions and my liver enzymes were elevated. They hooked me up to both bags of saline and within 30 minutes I was getting a third. I spent 4 days in the hospital, almost needed dialysis. And when I got out I couldn't even dress myself. My arms were so swollen you couldn't see my elbows. Had a similar experience. The doctors were shocked that rhabdo could come from a workout and not a car crash. The second time I had rhabdo, it was a lot easier to convince the staff to text my CK levels right away. That's nuts that the docs would dismiss rhabdo happening from a workout. I'm a physical therapist and we talked several times in PT school about recognizing the signs and symptoms of rhabdo, as it often is the result of overly strenuous workouts. Hell, I read the first sentence and a half of OP's story and my immediate thought was rhabdo, and they didn't even mention the condition until their second paragraph. Just goes to show that we all have our areas of expertise in the medical field, and just because someone is a doctor doesn't mean they know everything. Way back when, after baby number 2, I started gaining weight, felt like I had been run over by a truck, and couldn't remember basic words like chair/table. I made an appointment with my OBGYN. You're depressed, even though I denied feeling depressed. End of consult. A week or two later, I remembered I had a family history of low thyroid, not that it's necessarily familial, and made another appointment. Oh, my heart rate was 28. No wonder my mentation was garbage. I basically had no thyroid function, and these days I can't imagine having a doc appointment where vital signs weren't checked years later became ICU right now. My mother was told she was going through menopause at 35. It took another 10 years before she could finally get a doctor who would listen to her to run the appropriate tests. And they prescribed levothyroxine. That was over a decade ago, and she still feels better than she did during that period. OMG. I have no thyroid, having had it removed 12 plus years ago. The last 4 months I've been feeling really bad. Just started a new DR who changed my meds. I went to my PCP because I was starting to feel awful. Like really, can't get out of bed. Whole body aches, brain fog awful. The DRS said that my blood work was within range. I cried to my endo. I said, I know that you guys say that I'm in range, but I think it's my meds. You changed them and now I'm like this. She said, I don't think that's the problem. I want to do all of these tests, and what the heck, I'll change you to brand specific meds and see if it works. 2 weeks later, I'm able to work out again. I have more energy. I can think clearly. I still think I have some work to do to get all the way regulated, but I can tell for sure that the meds were my biggest problem, and they thought I was crazy. It started with pressure headaches, then I got up one morning and walked sideways into my bedroom wall. GP diagnosed labyrinthitis and prescribed medication for nausea. The headaches got more frequent along with spells of the most intense vertigo. 2 years of, it's just anxiety, from 3 different GPs. I started getting ringing in my ears, and sometimes my hearing would become muffled for short periods of time like I was underwater. I was reading everything I could find relating to my symptoms, and absolutely everything pointed towards Meniere's disease. Still, it's anxiety, and my GP laughed and called me Dr. Google. Eventually ended up at an out-of-hours clinic one night because my vertigo was so bad and I'd completely lost my hearing in one ear. This led to a referral for an MRI and eventual diagnosis of Meniere's disease. Signed, Dr. Google MD. Doctors need to stop with the anxiety BS and just say, I don't know, when they don't know. Diagnosed myself with ovarian torsion last year. The pain was indescribable and couldn't even keep down sips of water. Went to A&E. Medical staff tried to diagnose me with a kidney stone despite having no issue with peeing. Just saw I was fat and ignored my long-standing PCOS diagnosis. Multiple ultrasounds showed no calculi, but moving the wand over to just above my uterus did show my left ovary had dislodged and was hanging out there, being strangled by a 9 cm cyst. 1 salpingoophorectomy later and my pain was resolved. My creatinine levels were high for several days, putting me in AKI too. But that's because I was dehydrated. Doctor here. Many encounters with patients with their own ideas of what might be going on, often from Dr. Google. Always worth a listen to their story and what led them to their conclusions. Mostly wrong. Sometimes helpful, sometimes right. Had a lady come in and tell me a classic story of a pheochromocytoma, intermittent episodes of racing heart, high blood pressure, headache, anxiety, sweating. A pheochromocytoma is a benign or malignant tumor, can produce excess epinephrine/norepinephrine, adrenaline. She was relatively young with no prior blood pressure problems, and sure enough, BP high enough at her age to warrant screening for the odd causes of high blood pressure regardless of her concerning symptoms. Sure enough, had a pheo. Fortunately, benign. Got surgery, cured. Blood pressure was great thereafter. After an egg retrieval, I got myself to the and told them I definitely had a severe case of ovarian hyperstimulation syndrome. I thought it was a no-brainer. Boston IVF had warned me of what to look for and I had nearly every symptom, including the go immediately to the Ones. The doc kind of laughs and goes, maybe we should avoid Googling symptoms. He recommended Tylenol and was going to discharge me. It took me forever to convince them to just do imaging and check my ovaries, first time I've ever heard a doctor say, holy shit, that can't be right. My ovaries were each larger than a grapefruit. They called the on-call OBGYN, who admitted me immediately. Per my OB, I'm the only person my tiny hospital has ever had to admit for severe OHSS. You weren't even Googling symptoms. Another doctor had told you what to look out for. I'm glad you were able to convince them to check for it and fuck that. Doc.
Yeah.
I hope you mentioned that. I think I did, but honestly it was so painful. I was pretty panicked when we went in, and I'm sure I came across as super scattered. To all doctors, please don't laugh at the patients. I'm sorry you went through that. I had that and was so bloated with fluid that I looked 6 months pregnant. It was so painful. I'm just glad it didn't last long. I'm sorry you dealt with it too. I wasn't expecting that to be the worst part of IVF. I thought for sure it'd be the injections, but nope. I had to explain what it was to the provider on staff when I went in for it. The closest clinic is over an hour away, so I suppose they don't see that too often. That was so uncomfortable. Went to the doctor and he asked in a condescending manner what DR. Google said I have. I said that my symptoms matched up with multiple sclerosis. 2 years later I visit him and he has a resident following him around. She was the one that performed a test on me, Babinski reflex, that indicated neurological damage that led to my diagnosis of multiple sclerosis. This week will most likely see me receive the same diagnosis. Credit to my GP, who did send me for the preliminary tests based on my concerns, and then when it came back with a lesion with features most in keeping with demyelination, promptly referred me to a neurologist specializing in MS. My mom was acting insane. I had to call 911. I told the to test her for an UTI. I was right. When I was 17, I had what I thought was a stomach bug for about 3 months, but it wasn't going away. I finally told my dad about it. He's an obsessive hypochondriac, and listed a couple of my symptoms. He grabbed the most recent version of the Merrick manual off the shelf, because he's a crazy obsessive hypochondriac, and flipped through the pages until he found a diagnosis that matched my symptoms. He legit said to me, well, it's either an ulcer, Crohn's disease, or ulcerative colitis. It was Crohn's disease. He found that out from a book. People. I used to work in a health clinic, and the doctors would regularly consult manuals and books to figure out diagnosis. Seems reasonable to get it from a book. I diagnosed my mother's PEs, pulmonary embolisms. She'd had abdominal surgery the week prior and made an off-the-cuff remark about having to sleep upright as she was short of breath when lying down. That didn't sit right with me, so a quick Google told me about how PEs can happen, especially after major abdo surgery. Told her to get to emergency, stat, sure enough, 3 PEs. She's fine now, thankfully, but she sure as hell could have had a stroke if she hadn't have mentioned anything. Dr. Glaucomflecken's neurologist character here, the chief purpose of the lungs is to intercept embolized clots, precisely to stop them reaching anything important like the brain. Every PE is a stroke successfully prevented. No truly shocking stories, but I will tell you this, the longer I am a medical professional, the more I take careful note of a patient's reported symptoms or side effects. A patient may be on a drug that absolutely, positively, never caused dysphagia in clinical trials, but for your patient, it does. I believe them. There are a couple of hypochondriacs out there, but for the most part people are pretty in tune to their bodies. Lots of HCPs, I love you. But I am looking at you, medical residents, will write off symptoms as psychosomatic, but when you dig deeper, there is a treatable physiologic cause. I suspected I developed cholestasis of pregnancy while pregnant with my second child. How I figured it out is kind of a miracle, as it has very similar symptoms to HELLP syndrome, which is much more well known. I followed a woman on IG who sold leggings. I was a yoga teacher. Over the years, she became pregnant and lost her child within 36 hours after birth with no real cause. 5 or so years later, she became pregnant again and was closely sharing her experience, as a lot of her account focused on her grief and healing after losing her first child. She started feeling itchy on her hands, arms, and feet, and realized she had felt the same symptoms with her first pregnancy, but dismissed them. This time she went to her doctor, pressed for testing, and eventually was diagnosed with cholestasis of pregnancy, which can have adverse effects on the fetus, including stillbirth and fetal death. Connecting the dots, she realized that she had this with her first pregnancy and was highly likely the cause of her first child's passing. At 36 weeks, I started feeling itchy hands and feet. I lotioned, ignored it. But it kept getting worse. I kept thinking of the IG lady though, and I decided to go to my doctor. She thankfully said, "Let's test your liver just to check." Turns out I had cholecystitis of pregnancy, and likely saved my baby's life by not waiting. I was induced 2 days later and my daughter had no adverse effects. Not me, but I had a friend who had this with porphyria. We just used to call him the vampire because of the symptoms. Then he noted it matched for porphyria. But hey, that's rare. So surely not. Welp, he had that experience where the diagnosing professional says, "Hang on, do you mind if I bring a bunch of students in?" Not a medical professional, but one of my aunts was born in the 1930s and became a registered dietitian. She self-diagnosed as having celiacs in the early 1960s, which was almost unheard of at that time. That's deeply impressive as reliable diagnoses for celiac really only became common in the early 2000s, and without treatment had an incredibly high mortality rate. She saved her own life decades before the doctors would have. My sister was diagnosed in 1987 in Los Angeles by a visiting doctor from Scotland while she was hospitalized. He had just treated someone for it before coming to the US, and my sister luckily presented with the same symptoms. She was down to 90 pounds and the supplemental nutrition they were giving her had wheat, so she was declining during her hospitalization. The visiting doctor recommended changing her food and doing an endoscopy, and she was diagnosed only based on flattened villi and response to the GF diet. Now 3 more of my family members have been diagnosed and none of them had the same symptoms as my sister. So it was just sheer luck that her symptoms matched the Scottish patient's. I've diagnosed myself with many things and gone to the doctor about it. The only thing I ever got right was OCD, which explained why I diagnosed myself so many times before. Not a medical professional, but I was also carer once for the elderly and disabled. I had a client who was in his late 40s and had multiple system atrophy, MSA. He had been perfectly healthy his whole life, had been a police officer for many years before working in children's services, and had 3 teenage daughters. So why did he go to the doctors? He had been playing squash with his brother and lost a game. He had never ever lost a game of squash to his brother, and they were both shocked. He got checked shortly after and was diagnosed with MSA. Within a few years he was losing his mobility and was having difficulty with concentrating. He would have absent seizures and continence issues. Eventually, he lost all mobility and had breathing difficulties. He passed away around the age of 50. One of the loveliest blokes I ever met. His wife was wonderful too. Broke my heart to know he would never see his daughters graduate uni or get married. They loved him so much. I still think about them sometimes and really hope they are doing okay. I'm a nurse and correctly diagnosed myself with pericarditis after being sent home from the I was pregnant and had sharp chest pain that those mfers brushed off as heartburn. Like a knife in my chest. I'm still irritated 25 years later.